Hello, everybody, and welcome to this week's edition of It's Worth a Shot. This is Kyla Newland, account manager in Alaska, and I'll be doing our introductions today. We have a guest speaker from the state of Montana, and she'll be talking about NHSN, antimicrobial use and resistance reporting requirements that are coming up here. And we are actually doing a special series kind of embedded in It's Worth a Shot, focused on this component of NHSN reporting that will be required. And we will be doing it 5 sessions in the next 5 months. And that flyer was actually shared in the update or in the reminder that Miranda sent out. And I will show that right before we get started too, just to let you know what's coming up in that series. So we can move forward to the next slide. So just our kind of routine disclosure today, that some of the content does contain outside presenters for Mountain Pacific, and this doesn't mean that we're endorsing one resource or organization over another. We can go to the next slide. And then a few updates and reminders. We do have something we distributed via the listserv, the long-term care infection prevention risk assessment. And if you didn't receive that, reach out to one of us, your account manager in any of the states that you folks are working in, and we can get that to you. And if Miranda or someone else on the line for Mountain Pacific could put that link in chat, that'd be great too, for these resources. The top F tags in 2023. That's a 3-part series that's starting on January 30th. And that is coming to you from Farm America. And then also an upcoming call about immunization strategies for long-term care. And that's from the CDC and CMS, coming up on January 31st. Thanks, Callie, for putting those in there. We can go to the next slide. So as always, thank you so much for your participation. We will continue to meet every Wednesday, and do send ideas, and feel free to put ideas in the evaluation as well for topics that you might want to see in upcoming events. And then we do have one polling question today. So is your facility considering entering the optional data into NHSN for vaccinations for influenza and RSV? So last week we asked, are you currently doing it? And so this week we thought, well, let's ask if you're considering doing it, if you're not already. Well, this is great. It looks like we're getting close to 50% of folks are saying yes, you are considering doing it. Thank you so much for your participation. We can go to the next slide. So just our weekly influenza update. As you can see, looking at the color of our states, Montana has moved from high or very high into kind of a moderate or low rate of flu, which is good news. Hawaii and Alaska had moved there a couple of weeks ago, but Wyoming is still continuing to see a very high influenza activity as of this week. So still encourage folks to get their flu shot if they haven't, wash their hands, and stay home if you're sick. Move to the next slide. And then our COVID updates, we're seeing decreases in pretty much all of our metrics, except for that the deaths are up 10% in the recent week. But as we know, that kind of lags behind the disease kind of peaks. So that's not super unexpected, but just to give you folks an update. Go to the next slide. And if I could share my screen, Mary, I was just going to show really quickly the flyer for upcoming sessions that Tori is going to start us off with these sessions that are looking at the the reporting coming up for NHSN. So in 2024, we know the hospitals are going to be having to participate in this promoting interoperability program. And we anticipate other facility types in the future might have to do this as well. So that's why we're bringing you this information. And this is in collaboration with the Alaska Antimicrobial Stewardship Collaborative, which is a statewide group here in Alaska that has been working on antimicrobial stewardship for a number of years up here to support our providers and our hospitals across the state. And then also, we are incorporating this into this time slot because we already had a nice active audience. We thought it was a good place. It was a half hour. People could hop in and just learn a little bit about this upcoming reporting. So these are the future dates that these will be incorporated in our It's Worth a Shot series. So watch out for those. And I will let Mary take back over and introduce Tori Dahl, who is gracious enough to present to us today, kind of in our opening session, to give us kind of the lay of the land with what this reporting is going to look like. So I welcome you, Tori, and thank you so much.
Thank you, Kyla. As she mentioned, I'll just go through sort of the prerequisites for the antimicrobial use and resistance reporting that is mandatory now. So if you want to go to the next slide. So as of January 1st, 2024, all hospitals, this includes both our critical access hospitals and our acute care hospitals that participate in the CMS Promoting Interoperability Program, are required to submit their antimicrobial use and antimicrobial resistance data to NHSN. To obtain credit, you do need to attest that you're in active engagement with NHSN for a 180-day EHR reporting period, or else claim an exclusion. So this 180-day EHR period is the same that you use for all of your other CMS reporting requirements, and varies depending on your facility. So if you don't know when that period is for your facility, I would reach out to your quality department or your C-suite, and they should know the exact dates for your EHR period. But to say that you're in active engagement, there are two options. The first is option 1, which would be your pre-production and validation, and then option 2, which is the validated data production. Now, unless you are submitting already both AU and AR data into NHSN, you will most likely spend all of 2024 in option 1 and then begin option 2 no later than January 31st of 2025. Okay, next slide. I just wanted to throw in the exclusions there because I know that there are some facilities that may fall under these. So for the purpose of NHSN reporting, these are the 3 exclusions that have been listed by CMS. The first is that you don't have any patients in any patient care location for which data is collected during your reporting period. The second is that you do not have an electronic medical administration record, or a barcoded medication administration record, or an electronic admission discharge transfer system. This will go into a little bit more detail why you would need this if you need to report. And then the third is that you do not have an electronic laboratory information system or electronic ADT system. So these are the exclusions. You only have to fall under one to be excluded from this criteria, but all exclusions should be submitted on the last day of February through the CMS Hospital Quality Reporting System, and then CMS will review that to see if you fit an exclusion or not. Okay, next slide. So now we're going to go digging deep into our prerequisites. So what can you be doing now before your EHR period starts or towards the beginning of your EHR period? So the first one is to make sure that you have the required data systems or electronic access to the required data elements for reporting. So this is why those exclusions exist that we just went over. So for your AU data, you will need your EMAR and your BCMA and ADT. So to capture your antimicrobial administration, you'll need that EMR or BCMA. And then to capture the patient movement within the facility, you'll need an ADT system. For the AR data, you need your LIS or EHR and an ADT. So this will capture your antimicrobial susceptibility results in the LIS and EHR, and then your patient movement within the facility in the ADT. So ADT is your admission, discharge, and transfer data within the facility. So that's a system that should be in your EHR. And then the second prerequisite after you make sure that you have all those systems is to either secure a vendor or develop a homegrown technology. That has to be NHSN validated, and you'll need these to create what are called clinical document architecture files, so a CDA file. So on the next slide, I'll go a little bit more into detail on what those are. So a clinical document architecture file is a Health 7 standard that provides the framework for encoding, formatting, and the semantics of electronic documents. So over here, you can see just a quick depiction of what that would look like if you opened a CDA file. So it's more like a programming language than what you're used to in a CSV, where you can see the data directly. AUR data can only be uploaded to NHSN via a CDA file. There is no option for manual entry or CSV. So you need this vendor because the vendor will go into your system and it'll pull that data, the required data from your EMR or BCMA, LIS or EHR, and your ADT. It will then compile that data into these CDA files. They'll be zipped files that you will then upload into NHSN, or they can directly upload for this module to be reported. And then the next slide. So you're probably like, oh, why do I need a vendor? Who are the vendors? So what they would suggest is to first check with your EHR to see if potentially they have a module that can create CDA files. I know that there are some that do have this, such as Epic has the Bugsy module, which can create CDA files for you. You just want to always make sure that it is certified by the Office of National Coordination for Health Information Technology. And you can do that by doing a search on their website, and it should pop up for you there. If your EHR does not have a module that can create these CDA files, then this is when you would look into a third-party vendor or develop a homegrown software. Now, we will say CDC says creating the homegrown software is pretty difficult and is a pretty hard task, so they would recommend doing a third-party vendor, but if you do have the bandwidth to create a homegrown software, they won't stop you from going that way either. So they do have some very nice lists on their websites of vendors that have already been validated through their system. So they have a list for AU, the AU module, and also the AR module. Now, when you're picking your vendor, you want to make sure that it's a vendor that's on both of those lists. That will be able to create both of those files for you because you need to report to both modules for this requirement. APIC also has a list that you can look at as well. And then again, just checking to make sure that vendor is certified under the ONC, and then also to make sure they are validated for the synthetic data set, which is SDS. If not, then they have to go through that whole process before they can start working with you to test your own files. So that's why CDC sort of has those lists for you. They can't say, yes, use these vendors, but just to give you sort of a direction to go in. Okay, and then the next slide. So once you have established that you do have those data systems, you've found your vendor, then you want to make sure that you have everything fulfilled to meet the basic requirements of submitting to NHSN. So first and most importantly, are you enrolled in NHSN? I'm hoping by now that most of you are, but if you aren't, make sure you get that in the process. You also want to make sure that you've mapped out all of your NHSN locations. There is a list of codes that the vendor will need from you when they're creating their files for you, and this can be exported in that locations tab. You also want to make sure that you have an object identifier. So here on, you can see a little picture of what you would be wanting to look for in your file. So this has to be done by your facility administrator, but they will go into NHSN, go down to facility and then facility info. And then you'll see highlighted there, it says object identifier. If that box is blank, you want to follow the procedure that is here in this PDF to get you an object identifier. You will need this for your vendor as well. They'll request that just so that CDC and NHSN can match your file with what the vendor is putting in to make sure they're putting it into the correct facility. And then we always love our training, so make sure you complete your AUR module training. I really like their roadmaps, but again, it's up to you as far as how you want to do that. And then you also want to make sure that it's entered into your monthly reporting plan. So for this, you want to select FACWIDE in for both AU and the AR module, and then dependent on your facility, you also want to select all your inpatient procedure areas like your operating rooms and such. And also, if you have these 3 outpatient locations, which would be your emergency department, a pediatric emergency department, and a 24-hour observation area. Then the next slide. So once you have done all of those basic requirements, you also want to check your user rights. So they recommend to have at least 2 AUR specific users for each NHSN facility. So their recommendations would be 1, to have a pharmacist or a physician champion in charge of uploading that data, reviewing, validating submitted data, running reports and analyzing data. And then the second would be an infection preventionist who could also be in charge of uploading that data. So here we have a nice little table outlining what each person can do based on their rights. So if you're an administrator, all rights, that person would have basically all rights within NHSN. So they can add new users, they can add and edit facility locations, add and edit your monthly reporting plan, they can import that AUR data, they can analyze the data, they can join and confer group rights, and then also sign up for that CDA automation if you want to go that route. There's also the option, if you just want someone to analyze data, you can do that as well. So there is a user option that's just analyze data rights. And then there's also a customized rights. So let's say you have a pharmacist, you don't want them to have access to everything in your NHSN account. They can just add and edit monthly reporting plans, import the AUR module CDA files, and then view and analyze the AUR module data. So you can go that route as well. And then once you have checked your user rights, the next step would be, and then on the next slide, to register your intent to submit your data. So this, I just want to preface, do not do this until you have your data ready or almost ready for your test files. It has to be completed within 60 days of the start of your EHR reporting period. And then again, make sure those files are almost ready or ready. And because NHSN will send you an email request for those files once you submit your request, your intent to submit that data, and they need that filled within 30 days. So we just want to make sure you have those files ready to send to them before you get that request from them. So this is sort of how you would do it within NHSN. So again, it has to be done by that facility administrator. So they would go to facility, and then all the way at the bottom is the AURPI registration. Here, it'll fill in the information for them, and then they'll enter their information for NHSN facility administrator. And then there's this additional 2 slots on there. We would recommend putting anyone who will be using the AUR module in there, just because this is who will receive information from NHSN about the AUR module anytime they send out an email. So we do recommend adding those in as well. And then the next slide. So now that you've done all of the prerequisites, I just wanted to go into what data they'll be looking for and what your vendor will be pulling out of your systems. So for the antimicrobial use section, For your numerator, they're going to look for your monthly antimicrobial days. So this is the aggregate sum of days for which any amount of specific antimicrobial agent was administered to an individual patient by the route of admission, as documented in your EMAR or BCMA. So they do have a nice list of the 95 eligible antimicrobial agents. And then the routes of admission that they are looking for would be your IV, your intermuscular, your digestive, and your respiratory. For the denominator, this is where they're going to pull days present. This is different from everything else that we typically submit in NHSN, where we submit patient days instead of days present. So days present are the number of days in which a patient spent any time in a specific unit or facility, whereas patient days is the number of patients in an inpatient unit for each day of the month selected at the same time each day. So it's slightly different. This will be reported for all individual locations that you selected within that monthly reporting plan, as well as for your facility-wide inpatient data. They'll also collect your admissions data. So this is the number of patients admitted to an inpatient location in the facility. This will only be recorded for your facility-wide inpatient. The next slide. Then for your antimicrobial resistance section, this one is actually reported on an individual basis versus the other one, which is aggregate counts. So for your numerator, what they're looking for is any isolate that meets these four criteria. So the first is that it was collected within an eligible location or unit, the ones that we talked about earlier. So any of those inpatient locations and the 3 outpatient locations. That it was collected from one of the 4 specimen types. So they have it split into invasive and non-invasive. So for invasive, blood and cerebrospinal fluid, and then for non-invasive, that would be your urine and lower respiratory. For antimicrobial susceptibility testing was performed for at least one drug. It doesn't have to be on that list of the 27 NHSN required antimicrobials, just that it was tested for any sort of susceptibility. And then 4, that it was an eligible organism identified regardless of the susceptibility to all required antimicrobials. So this means that even isolates that are susceptible to all required microbials are eligible to be reported to the AR option. So, anything you test for susceptibility should be reported. And then for your denominator for your antimicrobial resistance, that'll be on the next slide. They're going to look for patient days again, so number of patients present in the facility at the same time on each day of the month. And then they're also going to look for your encounters, so a visit to an eligible outpatient location. This, of course, would only be for your outpatient locations. And then admissions, which would be the number of patients admitted to the inpatient location in the facility. So now that we've gone over sort of the prerequisites and data that they'll be requesting, I want to go into each option for you just so you know what they'll entail. That'll be on the next slide. So for option 1, this is the testing and validation of the AUR CDA files. So for this, once you select that you're going to submit your intent to submit, you're going to get an email from NHSN that will ask for 3 test CDA files. So this will include your antimicrobial use summary CDA, the antimicrobial resistance numerator CDA, and the antimicrobial resistance denominator CDA. Once you have these files created by your vendor, you're going to email those to the NHSN CDA help desk. And they will go through those and see if there are any errors, if it's good for you to go forward with submitting data. We do want to point out that CDC cannot open Zincs or Microsoft Pure files. So if that is how your facility submits secure emails, they would like you to email them and just let them know that that's how you normally submit, and they'll give you another method to submit those. If they do identify any errors, they want you to work with your vendor to correct those, and then you'll resubmit those test files until they come back and have passed. You want to make sure that when they do pass, you save that email that you get from NHSN. I suggest setting up a nice little folder in your email because there's going to be a lot of things that you want to save from them, but this is one of them. And that is it for option 1. Now, facilities can stay in option 1 for the whole calendar year, but then you have to move to option 2. If you are already one of those facilities that is sending your production AU and AR data to NHSN, you do not need to do option 1. You can just do option 2. For option 1, though, if you are, let's say, only submitting your AU data currently to NHSN, you will have to submit all 3 of these test files again, because they do need to test them all in one email and send that back to you for validation. And then the next slide. So this will be your option 2, which is where you're going to do your submission of your production data. So you want to watch this video, I really like it, on how to upload CDA files into NHSN, and then you can just begin submitting data. They recommend uploading this data within 30 days of the completion of the month. So there are 2 options: the manual upload, which is where you as a facility would upload your data into NHSN, or there is the direct upload, and this is where the vendor would submit on behalf of the facility. And then they'll send you back a couple of emails, and just make sure that you save those as well. And then I think the next slides are just a bunch of resources. So I kind of split it out by hopefully what you're looking for. So if you have questions about the requirement for CMS, here are some links to address that. If you're looking for your CDA information and vendors, here are those lists that I mentioned before. And then on the next slide, we have some more of the stuff for the prerequisites. So how to do that OID request, any mapping locations, your testing and validation checklist. This will be for if you are submitting production data to NHSN, and then just some AUR training and information web pages as well. And I'm sorry, I know that was a lot of information we crammed in here, but feel free to ask any questions.
Thank you so much, Tori. Yes, a wealth of information. A lot to digest. So thank you. I do see one question in the chat, kind of to the group, I think. Do most hospitals already have systems in place to get this data, or is finding a vendor going to be an added cost?
Yeah, so I know in Montana, we've been working with a lot of our hospitals to help them get these systems. So most facilities did not have them in place before this, and it is an additional cost. I know that a lot of our facilities are going with Medici or Vigilance, and I think it was roughly about, I want to say it was around $800 a month for those facilities that went with those 2. Not that I personally recommend those 2. I can't give you my direct recommendation for those, but just so you can kind of get a gauge on how much it's costing for additional costs.
We did have one earlier question that says, when does the reporting become mandatory? I believe that was January 1st. Was that correct?
Yes, so it started in 2024. So January 1st is when they made it a requirement.
And that, Tori, just to clarify, that's just the attestation and I don't have the right word, portion, and then you have to do the second portion by the beginning of 2025, correct?
Yeah, so for CMS, they don't actually get this data. So NHSN will not submit this data to CMS. All you have to do is to verify that you are submitting data to NHSN for the AUR and AR module in the CMS requirements that they have you fill out. So most facilities will spend 2024, just basically setting up how to submit this data, but they will attest to working on that with CMS for 2024, and then 2025, most will begin submitting their production data, or all should be submitting at that point.
Okay,
And we just
thank
have a
you.
couple more. Looks like Jessica Sims asked, what is this for hospitals only?
Yeah, so it's only for our critical access and acute care hospitals, and only if you're in the promoting interoperability program, which I believe most are. But they have not moved towards like our long-term care facilities, or even rehab hospitals are not required at this point to submit this data.
And it looks like Shauna King might have a question. Do you want to come off of mute, Shauna, and ask?
Yes, thank you. I'm currently submitting just AU data, have been for a couple of years, and I recently received an email to start sending in some testing files, and that we had selected option 2. We aren't ready to send in our testing files that you discussed yet. So do I just need to ask my NHSN administrator to go remove that option 2? Until
Yeah,
we're ready
because
to send our testing files, I guess, because they've emailed me multiple times asking for these.
yeah, and it's probably because you have already selected that your registration of intent to submit data. And so they're probably emailing you for that. I'm sorry, I don't really know if you can take it back. That may be something you have to ask NHSN if you can unselect that. But yeah, so for the AU, if you're just submitting AU data currently, you will have to submit test files for the AU and AR again to NHSN before you can start submitting your production data.
Okay, thank you.
Mm-hmm.
And then I do see one more chat saying, and we only have to submit for 180 days each year, correct? Or for the whole year in 2025?
So it'll still be, well, it depends on the ruling, but it should still be around that 180 days is what they've decided.
Okay. Thank you so much. Great information, and thank you everyone for tuning in. I know we're a couple minutes after. Your time is valuable. And I see one more question. Where do we complete the attestation? This is different from the intent to submit, correct?
Yeah, so this would be different. That should be through however you do your CMS verification. So I believe it's through that. Sorry, I'm not regulatory, so
Okay,
I
Tori,
believe
if you don't have the answer immediately, yeah, just
we
get
can
it back to us.
clarify
We
it
can put
next
it.
week.
Yep, next week we can put it on our question and answers from the previous webinar, and we can put it on there so everybody has. And then yes, we will get the link for the slides out to everybody. It will be on next week's reminder email. So at the very bottom of the email, you'll see first of all the link to our website where you can see all the It's Worth a Shots, and then the direct link to just the slides and to this recorded presentation will be on there as well. And so you can find that, and we'll also put those links on a slide for next week's It's Worth a Shot. So that way you can see it on the slide deck as well. And next week, the presentation is going to be on glaucoma and eye health, because it is February is, what is eye health? I'm sorry, what's the month? It's I should be more prepared for this. It's glaucoma eye health or something like that month. I'll get that corrected for next week. And then also there's going to be a short presentation by Vivint Health for us to watch. So we do want you to join us next week, January 31st. And then if you can complete the evaluation survey for us, we always appreciate those. We do take your comments to heart, and we do use it as ways to find new topics to cover. So if you can complete that, it's in the chat, we'd really appreciate it. So thank you everybody for joining us this presentation. Again, this was a series within a series here with the It's Worth a Shot, and the flyer for when those days, the next presentation will be on February 28th for this series. So we hope to see you then as well. Thank you.
Thank you, everybody. Have a good day.